So, we are very glad to have each and every one of you here to be part of this wonderful and amazing program that we're going to hold today. Definitely, we will start the program with an opening prayer. So we will have, we will invite Pastor Wolf and Alhaji Awudu to please come in front and start the program for us. It's so nice that in African we have two big main religions that we know, and we have Pastor Wolf standing in for the Christian community and Alhaji Awudu. Please come and stand in by Pastor Wolf so that together we do it together. Thank you. I love what you're doing. Thank you.
Yes. Amen. We greet you all in the name of the Lord. Is it on?
Yes, please.
Allow me to break protocol by stealing 1 minute for something else. Am I allowed?
Yes, please.
Okay. The Bible says we should honor widows who are widows indeed. And in our society, we normally don't see such things. We have Mrs. Doku in our midst. So on behalf of all widows who are here, if there is any widower here, please be on your feet and we honor you. You see, the tithes that we collect in the church, people who are supposed to benefit from the tithe beside the church leaders are widows, orphans, and strangers. But pastors don't talk about that. So let's use this and honor anyone who is a widow or widower here. Let's clap for them. It is not easy to lose your partner. Even I see young people grieving. And our social security system is very bad in Africa. So these are the things we need to honor. So we honor you. Second thing is, tomorrow is election. We, the grown up ones who lived with something else, we need to tomorrow go and vote. If you have not done the, how do you call, mail voting. In our midst, we have some politicians. It's not my duty to call them. Maybe the MC will do that later on. And I thank God that we are beginning in the name of the Father, and the Son, and the Holy Spirit. For Christians, we stand as honor to the Lord. So if you can, please stand to your feet. I won't pray for long, but I'll please plead with you to honor the Lord, that we stand on our feet. Eternal Father, we thank you for moments like this. Yes, Israel as a nation started in Africa. They were slaves, and you went and took them on your eagle's hands and brought you to yourself. All of us here are foreigners in a foreign country. We have decided to organize. Many a times it is a challenge for us coming together. But on this occasion, my diaspora and the ex-servicemen organization have put us together. We pray that your hand shall be upon them. Grant them wisdom, knowledge, and understanding. We pray, dear Father, that you save us from our predicament. Help us to understand the times and the season that we are in. We have a season where the earth is boiling. Challenges are here and there. But in all this, the foundation of the Lord stands sure. And you know that are yours. We pray for the leadership of these two organizations. Whatever they intend to do, whatever their vision is. Father, they need money and financial substance. Grant them, open doors and avenues for them. And I pray, dear Father, that the unity of the Spirit and the unity of working together, that in every meeting they will have a consensus, agree and move forward as one group, one people, one nation, one vision. Grant us that this evening, whatever they will do shall be to your glory. We thank you for hearing us. In Jesus' mighty name. Amen.
Amen.
Okay.
Thank you very much for showing us the unity among African people, the Muslims and the Christians. Thank you very much. Please take your seats. So we have all gathered here because of Ghana Ex-Servicemen Association, Hamburg-Mobile, and Minor Diaspora. We've gathered here because there is a mission that is ahead of us that definitely you will get to know the mission. And for us to continue with the program, we would invite the president of Ghana Ex-Servicemen here in Hamburg to come and give us the opening remarks. So please, let's show him some love with a clap of him as he comes and gives us the welcoming address. Mr. Emmanuel Ado. Wow, that's it.
Hi. Permission to give us a short speech. Thank you. You're welcome.
Thank you. Wow.
Honorable doctors, lawyers, pastors, chiefs, politicians, and distinguished office guests, ladies and gentlemen, it gives me a great pleasure to welcome you most cordially at the official opening of the African Community Strategic Leadership Meeting convened by Ghana Ex-Servicemen Union, IFAO GESA, in cooperation with my diaspora IFAO. This event is the highest point of collective efforts, which began in the early 20s when the COVID-19 pandemic began. Since then, many individuals and organizations contributed in one from another towards organizing this meeting. I would like to take this opportunity to express my appreciation to Dr. Stefan Dosu of Yapa, Germany, for the enthusiasm and assistance given to this initiative. More also, my heartfelt thank you to Ms. Irena Pia and Dr. President to Ramenu for their support. All of you here are our highly esteemed expertise from various African communities in Hamburg. We really appreciate your presence and hope that you will enjoy our hospitality. The question of appropriate financing of an event was raised by the beginning on behalf of the organizing team. I would like to thank Bogative System and Hamburg the financial moral support provided. Ladies and gentlemen, in recent years, we witnessed significant increase of sickness leading to many deaths in our community. This has raised enormous concern because almost every African family here is affected or was affected. African Community Strategic Leadership Meeting was the agenda mobile medical clinic in the African community. It's a health initiative designed to bring the health and care problem in front of community life, so designed our vulnerable and patients in future shall realize strength and organization health. In my point of view, it also requires collective effort and action to provide health need for the future in African community in Hamburg. I would like to assure you once again our commitments and support of building trust, mutual understanding, and a sense of belonging to the community. I believe openly that serious discussions will be a step forward to finding the best solution. Your experience, expertise, and readiness to share your knowledge and also highly valued and needed. I urge participants to give objective and careful consideration to the matters and items of working program. I'm sure that in the spirit of open discussions and willing consideration to solve the problem, our African community will be successful. We sincerely hope that you will find your time here very exciting. Once again, thank you for the participation. Long live Africa, long live African Organization Union, and long live, God bless the future African community. Thank you.
Sir, permission to follow, sir.
Permission granted. Thank you very much. That was so wonderful and amazing. Thank you so much. Great. So, one of the main reasons why we've gathered here today is to find a solution on how best we can mobilize ourselves, and then also to have a mobile medical clinic here in the African community. So we'll be having an open discussion, and I believe that whilst the discussion will be going on, all of us are not going to be spectators, but we are going to be participants. So please, on this note, before I come to the next person that will be talking, it's so amazing that that person, today is her birthday. Upon all that she is doing, she has still decided to be here. So please, let's sing happy birthday for our beautiful Dr. Stephanie Insia Dosu. Happy birthday to you. Happy birthday to you. Happy birthday, dear doctor. Happy birthday to you. Thank you very much. So on this note, I will call her to come and give us the keynote address. Thanks a lot once again, dear.
Thank you very much. Sit. Yes. Thank you. That was. Yes. Yes. Can you hear me? Yes. Okay. Thank you so much. Yes. So. Thank you for the kind introduction, I must say, unexpected. I'm very happy to be here. This is a very important evening. So this evening, I think it's a very remarkable evening. And I'm saying remarkable because I think you did not only come because you were invited to do so, but you came to make a contribution to an impactful solution. Don't look on your right how many people are here, but we right here are contributing something very great, and we will look back many years and be very great that we joined and made a contribution. So today I would like to talk to you about something I call, I don't know if it's working? Yes, today I would like to talk to you about something I call thinking beyond medical care. Thinking beyond medical care. I believe everyone in here has once been sick before. Well, it could be minor, it could be major, but we got better because our body's defense mechanism fought back in terms of a viral infection. It may be even a long-term illness, and we got better because we received medical care or are still receiving medical care. But can you imagine being sick abroad and with no access to medical care? For a family friend that I know, July 2005 was the year he found out he had kidney disease. Back then he was in London actually, and they told him his kidneys were failing. And because of paperwork issues, he had to fly from London to Ghana. And from Ghana, he went back to India for transplant. So he got a first kidney transplant. that first kidney transplant failed, and he had to have a second kidney transplant. That was successful. But I must say he's one of the very few survivors with kidney transplant. In recent times, however, that second kidney transplant that he had is giving him health problems again. What am I trying to say with this? If this person with the kidney disease had medical access earlier, maybe it wouldn't reach the phase where the kidneys are failing. If this person had access to medical care, or if they're taking their medical care seriously, it wouldn't reach the phase where the kidneys are failing. Because when diseases reach the end phase, they usually give us warning signs, but we ignore it. And most people say, time is money. Well, for me, time is health. There are situations when our health is involved. That's when we start to evaluate the ifs. If I have done this, this wouldn't have happened. If I have done that, that wouldn't have happened. If. Like I said, if this person with kidney disease, if they knew earlier what would happen then, they would have taken care of their medical care. If. But we live in a country with access to medical care. Grab it. We live in a country that has one of the best healthcare systems in Europe. Take it. Now, it is very interesting because most people don't even like going to the doctors due to whatever reason. And we can list so many reasons. Why would a person not even accept medical care? It could be this, it could be that. But I like to always base my statements on published scientific data. And this is very interesting data that I found. So this is a study that 1,369 participants took part in. And they asked them, what is the reason why you don't go to the doctor? What is the reason why you don't want to accept medical care? It's quite interesting if you kind of look at this data, what they found out. So if we start right here, for some people, they are just lazy. They don't want to just go to the doctor. Some people procrastinate. And I must say, this study was conducted in America. It includes Black Americans, African Americans, white, Hispanic, non-Hispanic, all of these people in this study. And laziness, forgetfulness, okay. Now, some people have low perceived needs to seek the medical care. This is 161. People believe like, oh, I will not go to the doctor because why? 55 people think that sickness they had, it would go away at some point. So why should they see the doctor? Some people also think, oh, I'm actually not sick enough because if I'm sick enough, I will go. So they don't even have the knowledge to evaluate their mental health. They think they are not sick enough. And some people think, okay, they think they don't even have health problems. So you see a lot of Africans, you ask them, do you want to go to the doctor? Go for a checkup, go to the, oh, I don't have health problems, I'm fine. We can see this in clinical studies when scientists sat together and they looked at this, that there are people who think they don't even have health problems. Some people say, oh, I'm sick, but I will take care of myself. Some said, okay, I'm concerned that the doctor will think they are hypochondriac. Some people prefer spiritual healing. They said, okay, I'm sick, but I will prefer sitting and praying, so I will not go to the doctor. I don't need medical care. Some people say, okay, my family will provide. Now let's look at traditional barriers. For some people in America, they said, okay, the cost is too high. You know, this we can see in 330 participants. Some people said, oh, they are too busy. They don't have time to go to the doctor. Maybe they don't have insurance, but in Germany, most people have insurance. Okay, some people don't have transportation. They don't have a doctor, they don't have insurance. Maybe they say, okay, I want to go to a doctor, but then I have to take this bus, I have to get off, and this is too far from me, so oh, let me just drink herbal tea and go to bed. And some people would say, okay, they are too sick to travel, so they won't go. You can see people think, there are so many reasons. And this is incredible because you have 1,369 people, you ask them, what are the reasons why you don't want to seek medical attention? And they gave so many reasons. And it's interesting looking at these. So some people said, okay, I don't have somebody to take care of my child because I have a kid, and if I go to the doctor, there's a long queue, so oh, let me just stay home, so they don't go. This is a reason for some people. Some said, oh, I don't understand the German language, perhaps, okay, why should I go? I may not even understand what he's saying. This is the problem. So now let's go to the other column. This column, unfavorable evaluations of seeking medical care. they had 456 people. So why? So most Africans think, okay, they have communication problem. Okay, I'm talking to this doctor, oh, he doesn't even understand what I'm talking about. Or maybe they are saying, okay, I don't even trust this doctor because he said I should do this test, go for the scan, but maybe he's trying to use me for experimentation. That's why I will not go to the doctor. This is the things people believe in. So now let's look further down. We can see the pointer works, yes. So we can see people, they believe doctors are busy, they have poor relationship with doctors. So people are going to the doctor and they think, okay, this is my doctor, but I'm just coming because I have to come. Maybe my mom sent me, my wife said go to the doctor, but I don't even believe in the doctor. This is also one reason why people don't want to seek medical help. So if the pointer works, I can show you the next. So yeah, they have low confidence in the medical doctors. There's some people say they have to wait for so long. For some people, they don't go to the doctor because they're afraid they will hear bad news. They know something is wrong with them, but thinking, okay, if I go to the doctor, he will say, oh, maybe what I'm going through, there's a cancer or something. Okay, I'm too scared, I don't want to hear this information. Let me just stay home and drink my herbal tea. They don't seek medical attention. This is one problem. So, like I said, people are scared that negative effects will come out. Other reasons saying people be like, okay, it's not a priority, they don't go to the doctor. There are so many reasons, as you can see. People can give that, and that reason. And this is quite interesting because when they did a similar, when you add these things together, so they said they have problems, they have traditional problems, they don't want to go, they don't believe in the doctor. What does it lead to? They avoid medical care. So in the end they said, I don't need medical care, I'm fine. And because of this, they don't make use of the preventive care. Because of this, they have poor health outcomes. And this is very common in our African community. And this is interesting because in Germany, now the study that I showed you was in America. And Germans thought, okay, in 2001, actually this year in May, some scientists in Germany thought, we want to know why foreigners don't go to the doctor. They picked 7,000 participants. When they picked that, they picked this in a cross-sectional study. So with 7,000 people who were aged 18 to 79 years, of this 7,000 people, 1,000 people were people with immigration background. And so they compared immigration background, non-immigration background. We want to see, do you make use of your medical care? What they found out will blow your mind. It's interesting because they found out that the first generation migrants, so when we talk about first generation migrants, these are people who have lived in Germany for up to 20 years. So it could be 10 years or 20 years, and they came themselves. So it could be you sitting there, you came from Africa, you came to Germany, you've lived here for 20 years. According to this German statistic, you are so-called first generation migrant. And these first generation migrant, they've lived, like I said, in Germany for up to 20 years. In this study, 2021, they don't make use of preventive care. What is preventive care? When we talk about preventive care, that's like you going to the doctor to check up. Maybe you have liver disease, kidney disease, you have things going on in your body, you don't know. You don't do general checkups, you don't go to the dental checkups, so you will not know if you have an early tooth decay, for example. You would not screen, somebody will have a boil and they say, oh, this is, in my language they will say this is pom-pom. They will add mercy cream, something on there for years. This could be a tumor. Because they don't go for screening, the time they find out it has metastasized to different parts of the body. And it's incredible that German scientists thought, we want to know why there is such poor outcomes in people with migration background. And when they found that first generation migrants, like I said, they make less use of it. The second generation are those whose parents were either born here, they termed it the same generation. They have a better outcome, but those who have lived here for up to 20 years in Germany, they don't use the preventive measures. And it's so interesting because I've heard a lot of people brag about, you know me, I've never been to the doctors for 5 years. And they are proud to say that. Look, I've never been hospitalized. Let me tell you one thing. Not being to the doctors regularly, or not having ever been hospitalized, or never going for checkup, that is not an achievement. Neither is it an accomplishment? That's ignorance. It's important that every individual goes for regular checkups. And what people do is, because they don't go for regular checkups, certain things happen in the body, like high blood pressure. When your blood pressure is increased, your head doesn't turn green or your skin doesn't turn yellow, that you think, oh, I have high blood pressure. Some things happen in the body is internal. So if you don't go for regular checkup, you would never find these things out. And sometimes also, what I know is that some people have symptoms and they ignore it. They may have, headache. There's a guy that I knew who had headache. He's had headache for a long time. So for them it was like, okay, it's normal. I know I always have migraine. So it's normal, it will go. Let me drink water, let me go for a walk, it will go away. But one day, he was found unconscious in his bed. What we found out was that this guy had a brain tumor. Never underestimate headaches if you're here in our midst today. Some headaches are a sign for serious health problem. Some headaches are a sign for hemorrhagic stroke. Some headaches are never to be underestimated. And so not to scare you that all headaches are serious health problems, but not all headaches. Imagine somebody has had headache at the age of 16 and to their 50th year, and they still have headache every year, and they think it's normal. When it comes, I have to sleep, it will go. No, you need to check up. And it's about time that we take our health very seriously. It is about time that we know when we have to go and seek the doctors. Because some people think, okay, what if I don't have papers? What do I do? So some people may have symptoms of stroke. Their hand is shaking. They lift their arm, they feel like, oh, I feel like this hand is numb. I can't move my arm. And then what would they do? Instead of ringing for an emergency, they think, oh, I don't have paper. Let me just drink this herbal tea, make this mixture, let me drink it. Let me pray. It's good to pray, but some things require emergency. And if you are an undocumented migrant in Germany, you have no papers, there is a law in Germany that says, the German asylum law, paragraph 4 and 5, regulates access to healthcare for asylum seekers and undocumented migrants. So if a migrant has no papers, they're in Germany, and they are sick in their head, and their bed, in their house, their hand is shaking, they can feel, they can't move their arm, they are having symptoms of stroke, this is an emergency, and the German law gives you the right to go for medical attention. It's better than being found dead in your apartment, because the German law says if you don't have papers and you have an emergency, stroke, cardiac injury, and so on, you have the right to seek medical attention. Now let's look at medical care accessibility from the other angle. So, which brings me to one of the questions, can you be sick, but then you get the wrong treatment? This happens most times, not only for foreigners, but also people who are born here, because there's some sort of miscommunication, misdiagnosis, even language barriers can be a problem, why a person might get the wrong treatment. And I always tell people, when you are sick and you go to the doctors, don't hold information back. Some people will be sick, maybe they have had headache or their stomach is hurting, and they'll go to the doctor, they'll say, yes, I got up, my stomach hurts. Doctors can't read your mind, they are not in your body. Give all the information possible. Yes, you vomited, your stool turned black, green, all this information is important to get the right diagnosis. Don't think, oh, this one, I think he should not know, it's not important. It is important. People get wrong diagnosis because they get the whole information back. They think, I should tell the doctor this, but this one I think is not important. It's not your option for the doctor. It's not your option, it's the doctor's option to decide which information that you need. And so when you go to the doctor, I urge you, all the information, the vital information, don't keep anything behind. Tell the doctor how you feel. And we have to be more conscious of our health. All the information possible, let the doctor know how you felt. Even if you don't understand the information, look for somebody who understands health-related information. Let them know what it means. And some people don't even understand health-related information. You ask them, maybe they have a diagnosis, and maybe they may not understand everything what it says on there. And Again, it will surprise you as 2,000 of the German population, random people, white Germans, anyone on the road. They said, hey, would you like to take part in this study? Join us. They took 2,000 people and they said, okay, we want to have a questionnaire, ask you certain things about your health, how you make judgment of the health, when you know when you have to see a doctor, when you know when you need a second opinion, such things, how you can work with health information. And it's so surprising because imagine you think you're a foreigner, you don't understand, but this is a study on the German population, people walking outside. And they found out that half of these people, 54.3% of this random 2,000 people they found outside, they had limited health literacy. So they don't know much about the health system. Okay, the doctor said I have this. Does it mean I have to follow everything? How can I use this knowledge the doctor said to advise somebody, to advise myself? Do I actually need a second opinion? They don't know when to judge. And this is not only blacks, this is not only migrants, this is the population, German outside people we can see across the road just like that. And it's very important. Why am I saying this? Because we have to understand what health literacy is. Now somebody may ask, what is health literacy? What does it even mean? So, health literacy is defined as a person's knowledge, motivation, competencies to access, understand, appraise and apply health information in order to make judgments, to take decisions in everyday life concerning healthcare, in order to do something that will prevent disease, to promote their health, to maintain or to improve quality of life during a life course. This, they found out that most people don't know. So you should imagine people, maybe they've been born here, they go to the doctor, they have misdiagnosed, they've been misdiagnosed. I know somebody who was born here and went to the doctor said, hey, you have an autoimmune disease, take this tablet. They've been taking it for 2 years, it turned out they don't have anything. Doctors can make wrong judgments. So if you go to a doctor, and the doctor said you have this, it doesn't mean, oh God, he said you are almost having a stroke or your heart is almost has shrunk in size or is not strong enough to pump blood and then you are shaking. When the doctor gives you a diagnosis, put it on the side. Okay, thank you very much. You go out, look for somebody who understands it so they can help you. So look for a second opinion. That's when you can make a judgment. Don't say the doctor said this and then the doctors are always right, but sometimes you may feel that, okay, he said maybe your liver is damaged. You feel like, wow, you don't have anything, you've never been sick, you don't drink alcohol, you don't take any drugs. The liver is most target of this, you've not done anything. In your family history, it's not like that. How liver damage? Okay, he said you have liver damage. The results said that. Okay, thank you very much, but let me go to another hospital to do another lab test to see if the liver is really damaged. Seek for a second opinion. Because this is very important. This is what we call health literacy. People don't know, and this, not only foreigners, like I said, in the study we saw that 2,000 random people on the street, when they saw them and they asked them these questions, they didn't know when to make that judgment, whether they need a second opinion, whether they need to evaluate the health information the doctor has given them and apply them to their daily life. So where is medical care today and where are we going? So with so many things that is changing around us, what is beyond the medical care that we know, such as going to the doctors? Digitalization. Medical care has been approved for patients with innovative technology solutions. So we are connected to care through apps. I remember back in the days, or even till now, people would go to the pharmacy and get a blood pressure monitor, for example, and which is still available, but now there are smartwatches that can monitor a person's blood pressure. It can monitor a person's pulse, it can monitor a person's blood oxygen, and even how much sleep you have. Have you enough sleep? Some people are so sleep deprived that they cannot even look back when they slept properly. There are apps now, we have to embrace them. Apps that will tell you, okay, I think your sleep is disturbed, you don't sleep well. They don't even know. They just get up every night after every 2 hours and they think it's normal. They accept, okay, I can't sleep at night, it's normal. It's not normal. If we embrace where healthcare is directing now, the accessibility and where it's heading, we will make use of digitalization. That is through these apps, like I mentioned, a wristwatch that can monitor your sleep, your heart rate, your pulse, and so on. And we have learned so much from the pandemic, you know, not only working from home, but also our healthcare has been updated. In the market, telemedicine has exploded since COVID-19. People can now call the doctor and say, hey, I don't feel well. The doctor can open a live video, they can talk to them. Things have changed, things are changing for us. We have to embrace digitalization. So countries like Finland or Norway, telemedicine has always been part of their medical care. But with the pandemic, Germans are now willingly accepting and embracing medical care. And so if you go to a doctor, the doctor says, hey, you can use online to book appointments, or you can use this app to do it. If you don't know, let someone teach you, because that's where technology is taking us. Otherwise, you'll be left out. This is where technology is going. And so it's very important that we make use of these. We have to embrace them. So like I mentioned, our accessibility to healthcare is getting better with time. And this evening, today, what I want you to remember is about 3 things. Be more conscious of your health. Be so conscious of your health that you know, okay, I know I've done my general checkups, I'm fine, I'm okay. Let your medical needs be heard. Some people are sick and they keep it behind. They don't even communicate with their wives. So they see, they faint and the wife is trying to think about, okay, what did my husband have? He never mentioned anything. Let your medical needs be heard. If you go to the doctor, don't hold information behind, because they need this to make the right diagnosis. And lastly, like I mentioned, embrace digital health technologies. E-health, like I mentioned, embrace it. It is part of us. We have to move with the time, as I mentioned before. And more of this to follow in subsequent presentations. And with this, I would like to thank you for listening.
Thank you very, very, very much, Doctor. That was so powerful. It's so nice to have, please, let's show him some love again. I mean, with this explanation, the presentation, that was so nice. When she was concluding, she said, be more conscious of your health, embrace your medical. Let us give attention to whatever that our bodies are telling us. And then let us embrace digitalization. That was very, very powerful. Great. With all this said and done, we will continue with the program, with the presentation of a project. I won't mention that project because I want that lady to do it herself. Please, before she comes, we have in our midst, just a minute, let me acknowledge. Thank you. We have Mr. Clement Kuche from CDU. You see here? I'm going to Nab. Thank you. And then one of our best and our own, Mrs. Irene Apia from SPD. Thank you for being our mouthpiece and, you know, for representing us, for making us proud. Whenever we see your pictures and your posters, we say, yes, ich bin auch da. Yes, man kann mich auch hören. Yeah, dankeschön. Thank you for standing out for us. So then, at this time, I will introduce this man that has been so outstanding. You know, his heart for what he does is so amazing. Please help me welcome Mr. Osei Tutu as he comes. Please, let's show him some love because he's been so amazing. Please, let us show him that we appreciate what he's been doing. Thank you very much. Thank you.
Thank you very much, MC. Distinguished guests, ladies and gentlemen, this is the first time that we have this African community meeting here, which is a strategic leadership meeting with its agenda, mobile medical clinic in African community. organized by Ghana Ex-Servicemen Association, registered in cooperation with Mali Diaspora, registered. The members of Ex-Servicemen Association are former Ghana security officers. Most of us are pensioners and old adults. We recognized in 2017 that there are no senior services for African community old adults here. That passed our cultural needs. We therefore decided to secure a meeting room for African adult active living programs. Also, we embark on strategies to reach out to the isolated adults and engage them in recreational and social programs. Our consultation with staff of Paritetis, Hamburg and Senioring Bureau, Hamburg, eventually connected us to the staff with our consultation with the staff of Paritetis, Hamburg and Senioring Bureau eventually connected us to the organization Arbeiter Samariter Bund, ASB. They offered to share with us one of their senior recreational facilities. Earlier, the staff of Paritetis, Hamburg offered us one of their meeting rooms to start there with. However, after several programs there, participation was not encouraging. Still, we are committed to continue it. Mali Diaspora is an African professional association in Hamburg. It has a vision for health improvement projects for Africans. It also wants to operate a daycare center for our community adults. There are individual groups, example AGNA, which used to host health education annually for our community. Ghana Catholic Mission also has interest and was trying to organize health education and health screening in churches in the community. They had one-time basic or as a special event health program. It did not include permanent health services. We therefore recognize the need for all the actors to come together and be a part of one health promotion strategy. We want a healthy community. However, the work ahead is extremely big. Resources are limited, but we can work together to leverage resources and create a quality health improvement project. More than 40 community experts, including health professionals, advocates, pastors, chiefs, influential community members, and subject matter experts are here today to identify our priorities and plan for action over the years ahead. This represents the start of collaborative activities that promote health and healing. You are the experts. We appreciate your ideas, and also we are ready to work with you. The population of people of foreign background in Germany is 21.2 million. Out of this figure, 11.4 are total foreigners, and African population is 615,830, representing 5.4% of the total foreigners. That is Ausländer Central Register, stand 29 March 2021. Big percentage of the African population in Germany can be found in Hamburg. The African population in Hamburg is around 53,000. It is migrant and minority group. Ghanaian community is the largest community in Hamburg. According to the statistics, statistics Ausländer before Chrome, Hamburg dated 31st of 2017. The population of Ghanaian residents as reference is 13,263. Ghanaian population groups under 18 years, we have 35.2%. Above 18 years to 60 years, we have 60.3%. and 65 and over 4.5%. We have all groups. We have children, youth, adults, and seniors here. African community faces problems in the foreign areas: race and inequalities, income level, education level, insurance status, language preference, uninsured or impoverished adults. Our students in school are having stress. We are recipients of social services, example, heart fear. Individuals are having financial stress and doing extra jobs. Pensioners still actively working for livelihood, and homeless individuals. Even though the community has a younger population, the above-mentioned socio-economic factors continue to play adverse roles in the health of our community. Those in our community who lack source of health care often have more difficulties obtaining care when needed, and are more likely to wait until their condition worsens before seeking treatment. The community experiences poor health outcomes. For example, there is high death rate in Ghanaian community. The people die mostly from heart-related diseases such as stroke, high blood pressure, diabetes, and several other conditions. Our health priority areas include the leading causes of death, the rate of chronic disease, preventable disease, and health behaviors, example, physical inactivity and poor diet. It is also important to emphasize how healthy Africans here are while alive. As we age, our risk of poor health increases. Our plans begin with making health equity a shared vision. African community members will take responsibility for improving and sustaining health care through shared leadership, strategic planning, meaningful community engagement, and a coordinated action. Our goals are focused on building consensus on 4 main priority areas. 1, eliminating structural barriers, example, uninsured. 2, linking our community capacity to access preventive and primary care. 3, chronic disease management, example, cancer and diabetes. And 4, healthy eating and active living. This improves diet and increases physical activities. It reduces rate of childhood obesity and adult obesity. We have to recognize that the scope and complexity of advancing healthcare in African community is beyond what any one sector can achieve. Also, developing a community-led health strategy does not happen overnight. However, we can work together and focus on health improvement strategies based on equity, thus all residents have the opportunity to live healthy. We also recognize that the work individual partners are doing to address community health needs sometimes overlap. So to better address our needs, we have to understand each other's perspective and identify our shared priorities. Our objectives include help to provide medical service better tailored to African population and health service more community-oriented. It also includes ability to apply knowledge, experiences, and opportunity for community leadership, development, and capacity building. The following scenarios suggest the need for mobile medical clinic. 1, repeat symptoms presented in the emergency department, example, heart attacks, high chronic disease, high hospital readmission rates, high emergency department and utilization and hospitalization, and then alarming rate of mental-related problems. Our community access and resources. We will also consider the assets and resources currently available in the African community that can be mobilized to address health issues. These include the following: human resources. Examples are individual expertise, training and skills of residents, professional groups, faith-based groups, associations, and business community. We have the physical resources. For example, locations that are accessible to the community population and provide public space and meeting rooms. Example, churches and mosques. We have information resources. We have informal network of communication, media houses, information portal, and social media platforms. Political resources. We have elected and appointed officials who advocate for resources and policy changes. So our plan of action. The agenda mobile medical clinic in African community programs will focus on chronic disease management and prevention. It will also improve access to care for undocumented community members. Our plan provides a roadmap for how we plan to achieve them: coalition building and community networking, establish measurable objectives, and coordinate resources to achieve them. Our plan includes having a steering team that will track our strategies annually and share a progress report. The report will document the effectiveness of the proposed strategies, any changes in strategies, additional resources, community access needed, and any challenges we may face in achieving our goals. We should recognize that tackling such issues require multiple prayers and more resources. This partnership may have considerable potentials to unite our community, healthcare system, and hospitals in Hamburg around our needs. We believe that this project will improve our healthcare, and there are consequences if we do not intervene. This is the moment. Thank you.
Thank you very much, Your Excellency. That was so amazing. The team have already been set. The agenda for this meeting have been set. With that said, we will invite our lady, Irene, up here to please come and do the presentation of the project Mobile Medical Task Force. Okay, so like whilst we're still getting ready, our main reason for gathering here is to bring out ideas. We've heard from our lady doctor what she said. How best can we improve the rate at which we are dying, the rate at which the African community does not understand certain things? How can we bridge that gap? And through this, with the help of Ghana Ex-Servicemen Association and the Maya Diaspora, we've all gathered here. So please, whilst we're doing the presentation, ask yourself questions. How can I contribute to this powerful project? Thank you, dear.
Good evening, everybody. Do you hear me well, or is it good? Okay. Well, good evening. I am very happy to see a lot of people, all of you here gathering together for the purpose of this mobile medical clinic. And I was asked by Mr. Oseitu to come and join him and present the idea that he has created with his association. And we are gladly also cooperating together in that project because we believe that the cause is genuine and it is right for our community. As you have already heard, the cooperation is based on us being just a cooperating partner. The idea is Ghana, from Ghana ex-servicemen. And we intend to be an umbrella organization, but I will explain more to that later on, and would come to the state of the art. Where are we right now? You know, the African community in Hamburg, we have heard it is a fast-growing community. And we have the numbers that we saw before are just the numbers of people who are registered. We have almost 1/3 of them, of the numbers who are not even being recognized. It means that they're undocumented. So you can bet on a number of around 72,000 African people living in Hamburg, which makes us a great and big community after UK, London, the biggest in Germany. Nevertheless, we are also facing systematic inequality, that must be said, and also social or economic lacks in the system. We are facing struggles in income, from income to housing. And of course, most of that are also based on immigration status. Some patients are even disengaged. We have a lot of people who are, we are a big community, but it doesn't really mean that we're always together. Some of us are also, you know, they decided to stay on their own and keep distance from the community. That is fine, because everyone has his own, his own opinion on how to live. But sometimes those people are alone, and when they're sick, there's no one around them. And a lot of the members of our community are not very, don't have much trust in the medical system. Stephanie has already basically laid it out, that there are so many reasons for that. But one of the main issues is also, if you take a look at German's history when it comes to medical services towards Black people, well, there are not so much researches that are based on our community. Before they actually see that you have this and this disease, they basically look at their knowledge that they have based on white studies, not on Black studies. So before they actually see that someone has a kidney problem, they will basically, you know, look at their statistics and won't see that our heights, our rates are different. So when push comes to shove, it is already too late, and that's when they diagnose what they are diagnosing. This is like, it's a common thing, because I've seen it with a friend of mine, I've seen it with my own father. They basically only saw that the kidneys are not working when both were not. Without, and that is truly sad, because we have a high number right here. We are without, we are not so self-organized, and usually not sustainable, even though we have a lot of organizations who are trying hard to bring these issues to our attention. We have been ignorant, as you said, for the longest. And it is not easy to make, to create a systematic and sustainable structure for us, because we have so many different issues and reasons why we are not attending medical services. So one of the goals are to create a sustainable network within the community and support ourselves. So we are now talking about the mobile clinic, the idea of this wonderful gazer. How are we going to reach the community? Community members, organizations, and local providers will refer patients, and I mean, you are the stakeholders right now. You are the one who are close to your community, whether it's the pastors or medical professionals, also just local leaders who will actually tell their folks to go and see the doctors. Every one of us needs to be an advocate on that. Because our community is vulnerable. And we have also people who are excluded. For instance, as we have already heard, we have a lot of uninsured people, even in Germany. There are people who are not necessarily undocumented, but they're still uninsured. Then we do have people who are underinsured, like they didn't take the fullest benefits. Some of them never went to the dentist. Even though there are just little bonuses where you can actually grant or step up in your insurances. Some people are disconnected, as I already mentioned, and we do have, unfortunately, some homeless people also among our communities. We wonder how this was possible, because most of the people we do know, but we don't really, watch, because everyone has their own struggle. And when you look to the left or right, we do have some people who struggle without living on the streets, not having a place to stay. So this mobile clinic is heading to the communities. It will drive to the people. That is the whole idea of this concept. The mobile clinic will basically go to the churches, visit the mosque every Saturday and Sunday, and it will rotate. This time they will be at Pastor Felix' church. Next week we will be at Pastor Wolf's church. Then we'll pass over to Ali's mosque. Or we love to party. We love to have events, and that's where we gather. From time to time, the mobile clinic will also head to events like this, or maybe outdooring, and other things. And also, the mobile clinic will also drive to the community, look for people who are in need in the neighborhood. When you know that you have an uncle in that street who is not really feeling well, you can also let them know, and they will tune over there and come to that places. So, as we said, how is this, what's the fantasy of this whole mobile clinic? Well, basically, we will work with doctors or people who are in the health system. There are some cooperation ideas of meeting up with other corporations like Black in Medicine, foundation where mostly medical students and professionals have come together in order to serve the community. So when they heard about this idea, they were the first to say, we'll join you. If you want to do like vaccination, we have our people. We can come and vaccinate them. Or if there are any other issues, just let us know whenever you're ready. We will support. But that doesn't mean that it's just going to be African doctors, because I believe that we have to partner with. There's allyship also out there, and some of the people and doctors were already supporting the community in extra serving will also join. So that is where we have to build allyships and also use that. It will travel to medical underserved areas, as I said. That doesn't mean that church and mosque are underserved, but we do have other regions where we know, like certain areas where we know there's a lot of Vettel, for instance, Williamsburg, a lot of people live in there, but there's still less doctors in that area, also in Wilstedt, less doctors in that area. So when you turn up to a doctor, you will line up and queue. It is incredible. And another point is we will have to connect patients to the healthcare. So another point is that this whole offer is supposed to be free of charge. Now, how does that work? First of all, the staff that we will be offering will, as I just mentioned, like Black in Medicine, or people like this Dr. Stephanie Nsiatu, and Dr. Main, who's also there, who's been serving the community for the longest. They bring their language skills so that people who doesn't really speak the German language or think that is the barrier will also be able to communicate their issues. Sometimes they won't even think that they got issues, but if they come and for a checkup, they might find out, hey, your blood pressure is too high. Yeah? So the vehicle-based clinic will make it easier for patients to access the appropriate type of care. Health educators, dietitians, and health counselors will provide a variety of services and counseling in a culturally and linguistically competent manner with a welcoming physical environment. This clinic will provide free screening, education, coaching, and health navigation service to underserved residential and connect high-risk patients with primary and preventive care. Primary and preventive care. What does it mean? Basically, the mobile clinic will first of all just give basic checkups. Don't intend or don't expect that they are going to do the operation or something that needs to be done by the specialist or in-house. So the program will provide basic examination and counseling at that point based on finding from any tests or medical results given. Staff can offer oral and written education, like they will counsel you, tell you how to, what's diets or exercising, medication, how to, go along with that. So all clients with positive screening will receive referrals to their primary care physicians or other health centers, and so on. The services are also including dental cares as well. And the health educational side is what I basically just broke down. So we will also collaborate with other stable community health platforms. And that is where we come in, because we all know that Mr. Seitutu already mentioned one or two of those organizations. He said, I think Paritätischer and I believe also AVO or one of those people. They are called the umbrella organization of the non-statutory welfare organization of Deutsch Spitzenverbände der freien Wohlfahrtspflege. Now, they are the ones who are, they have the interest of the groups. Even a brief look at the system of interest of the group, you'll see that this is about representing other people's interest. And Mr. Seitutu already mentioned that they gave him the opportunity to do so. Now, every time when you hear they gave you the opportunity to do so, you must actually know there's something in it. So basically, that is what Meine Diaspora is attempting to do, because these are the 6 Spitzenverbände. Now, we are adding 2 to it. In 2018, the Muslim group also decided to do another Spitzenverband and came together in a round and decided to go along. Because if you see, you have the regular people, either Deutsches Rotes Kreuz, Paritätischer Wohlverband, Caritas, AVO, which is a more political based diaconie, and the last one is ZWST, standing for the Jews. The Jews have their own welfare organization. So the next one are the Muslims, who decided we have our own interest, because even though those people are there, there's no one who can represent our interests better than ourselves. Now, where are we? We are always under one of these structures. And this is where Meine Diaspora comes in. We intend to do our own structure. And this is why we are cooperating with him. This is why we are cooperating with Black in Medicine, in order to create our own systems. We believe that we are going to go back home, most of us, never thinking about the reality check, that one might just leave here, go to the train station, and before he reaches there, he might just fall. So that person will most probably land in a clinic, or at the end would just end in one of the Pflegeheime. Now, when you end there, those people who are there, they're trying their best, but they don't know much about us. So the people, me and some other interest groups decided that we're in that system. We see that every day when we go to care for them. And they feel so pity and sorry, never wishing that their mother or father will land there and end up there. Why would they say that? Let's start with our physical. Not creamed well because they don't know our skin is dry, they don't know how to comb our hair. When you get older, you want to eat your fufu. They don't serve you that. If you get old, you tend to go back to your memories of your childhood, so you will start speaking in your mother tongue. It is not German. So these are things that makes it necessary for us to take care of ourselves, to take care of our interests, and we intend to go there. We intend to provide, like nowadays, no one really wants to go into a Seniorheim, Seniorenheim. They rather come together and say, okay, let's join our houses together and share Senioren-WG. Because you don't want to feel like you're old. And the funny thing is, when we actually were talking about the African Community Center, we already thought about Seniorentreffs. The community said, we don't need that. We will take care of ourselves. Now, we are in Germany. Your daughter might love you, your son too, but he or she needs to go to work. So she or he won't be able to take care. So we have to know that and come together and do something for ourselves. Well, how are we going to finance the free services? We're not even talking about the mobile clinic yet. That are the free service. Well, the intention is to generally get general fundings and also support from state and federal fundings. There are grants for foundation on EU level, on federal level. We intend to also get support from independent companies or drug companies, even though they are one of the most, well, mafia, as I say, and private insurances and providers. The aim is that no patient will be asked to pay for the consultation that he or she receives. So what is the purpose of today's meeting? We've heard a lot, but there are two goals that we set for this meeting. First of all, we need your feedbacks on this idea that is somehow a concept, but is not finalized. We intend to bring in your expertises, your knowledge, your competences, talk about that and make it a good concept. And we like to track the measurements together and reflect on the cost, because this is not going to be easy and it's not going to be a low-cost agenda. And we will also have to think of like sharing our thoughts or even working with other associations who are already out there. Never mind. And so we'll try everything to also work like, there are other associations like Mimi, Emmanuel told me about. They do that already. So we might share the costs with other institutions that are already doing that. Everything is possible. We just need to find, we need to, first of all, unite in that idea, and then just, go for the best thing that makes it. It's not going to be easy because they will try to put us under one of those umbrellas and tell them, oh, Datish is already doing this and that. Oh, you need to link up with AVO because basically they want to fight for our interests, because our interests will always make them greater. So basically, let's get it started. Thank you for the attention, and let's talk. Oops.
reason why we're having this meeting is now to discuss about how we can implement the mobile medical clinic. What do you think? You heard a lot. Let me first of all start by, you can please give me the mic. You can give it to anybody. Can you do it? You just go around, look for anybody at all, and then we do the talking. What do you think about the mobile medical clinic? What do you think? That's nice. What do you think? Do you think it's a good initiative? Do you think it's important? Do you think, what is your opinion about this project or this concept?
Good evening.
Good evening.
Do you hear me?
Yes, please. I can, but I don't know whether the rest can.
Then I have to go above my voice. My name is Richard Churufo. I really appreciate the way, and thank you very much. I really appreciate it, and I welcome that also. And I will say I will also do my best and assist in case of if that is needed somehow along the line. Thank you very much.
I will come back to you with the next question, but after this time, I will. Because I want us to first be on the first question. What your opinion? You have. Let us know that your opinion is very good. So we want to hear about almost all of you. Go to Mr. Desmond, please. Mr. Desmond is sitting over there. Mr. Desmond, thank you. Go to him. Let us hear what you think about this initiative. When he finishes, you come to Pastor Felix. Yeah, you don't worry about it.
I think we need to congratulate the organizers for a great initiative, and the concept is it's a noble idea.
Wow.
Yeah, that's the thought well about how to actually assist our people, and moving to the people is a great initiative. I think it's just a suggestion that beside that they should also look at if there could be a physical point where people can also go to them. That's when they have a problem, that they do not have to wait till they come to them, but they can also go there to meet them. Okay. Thank you very much.
Okay, so you also giving a suggestion that they should have a place that they can be located, right?
If it is possible, they should integrate it into their talks.
Okay.
That maybe on a Saturday night, one of our people has a challenge, then he knows where or he could locate them. Thank you very much.
Thank you. So, select somebody. Oh, Pastor Felix told me he wants to talk. Pastor Felix is here, please. Pastor Felix is sitting right there. What do you think? Give us your opinion.
Thank you. I think I also applaud this initiative.
Wow.
Standing in for the churches. We will much benefit from such an endeavor because we tend to first house all the undocumented migrants, and we bring them to different offices and locations for help. So when the help comes home, we are much grateful, and we look forward to see what support we could also bring. All our doors are open.
Okay. Any more feedbacks? Do we have people that still wants to say something? Anybody? Yeah. Mr.
Yeah. Okay, I'm Ali Audu from the Muslim community here in Hamburg. I know we also have a very big and large community, and we know how it is. Even today we're having an INF campaign in our place, and I just left here, so we know how important medical care is, and we have so many immigrants that don't have even stay. That's why we organize it ourselves, that people who don't have stay can also be vaccinated. So we are 100%, we appreciate this. Mr. said to call me, and I said yes. Now the medical care is coming to our home. We like it, we love it, so we are really happy about it, and we are also going to support it. So my next question will come maybe the next, how are you going to sponsor it?
Okay, now.
That is also my question.
Good. So, I think, let's see by hand those that think this is a good initiative. Let's see by hand. Let's see by hand. So, almost everybody here is in agreement to it. So, we say thank you very, very, very much for the, let's give them some applause. Thank you. For taking, so, then I come back to say that, how can we do this? Because almost everybody sitting here is an influential person in a community. If I pick one person, I can see maybe like 1,000 people under him or her. So how can we do it?
Thank you. I'm not, how can we do it will be the next thing that I just wanted to say something to the first round.
Good.
A small critique. It's good to have this, but it's also important for the mindset of our people. You didn't talk about that, but that is the main basic thing. The mindset of our people that healthcare is also about self-care, okay? And not having the mindset that, oh, I just came here for a job, you know, I just want to have something quick, and then go back to to the place I was born because I want to build a house, I want the expensive things, and I want my status. But then, forgetting about the self-care of themselves. So it's very important as a critique or as a small hint that one is also included because it doesn't mind if I still have the mindset that I'm just coming here to make money and go back. It won't help because I just see that, okay, there's this mobile thing still away. Maybe I'll need it, maybe not really because I still, I'm just looking for a job to do. So the mindset is almost very important.
That is
what I want to say.
Thank you. Over there's somebody else. We have like 2 people. Thank you.
That's Nana Obsuyos from Ghana National House of Chiefs. So, there's one question that I wanted to know. It's very, very cool. This initiative is going to help the society in general. But how are we going to reach the people? Because there are so many people who are not going to churches.
Sorry, what was the question again? How are we?
This is from the first one. So we come to the second one. But this is the first one before this second question. From the how are we going to, do the problems. This is from the first question. The problem is there are so many people who are not going to churches. And so as we are here, we have so many, everybody is under, as you said, about 1,000 people under the churches, the Muslims and so on, but there are so many people who are not going to churches. And how are we going to reach these people? This is one also, this thing that we have to also know, how we are going to preach the people that we are having these mobile medical clinic that can help the society or whatever. And it's very, very, I think sometimes you get the illiterates and literates within the community, and it's a bit difficult. So we have to plan also how to reach everybody to understand this and so that we can move forward.
Very good. And that is also, I think it's in conjunction with what Our Lady, how can we educate the mindset of our people? Okay, good.
I think she has already said it.
Yeah, what I just wanted to say, I'm Armiya Mohammed, Imam Armiya Mohammed from Masjid al-Rahma, together with Brother Ali here. I just wanted to say something that our sister started quote unquote by saying critique. But we should analyze the point critique here. It's a suggestion that she's bringing.
Suggestion, yeah.
So we can eliminate the word critique and say, okay, I have an addition. Okay, let's do this. Because that's what you said. What is your mind? Say something. You see how the organization can go forward. So in this case, we should put the issue of criticism aside. Then we go forward by saying, how can we educate them?
Suggestion. ideas.
Genau.
Thank you.
That's what we're supposed to do, like what's the brother behind also said. So, in a nutshell, let's say education.
Thank you.
That can help us. Thank you so much.
Great, thank you. So,
Yeah, thank you. My name is Ifo Anigo from the Ever Union, Hamburg. We also think it's a very noble cause, and we are here to support. And for me, most important things are ideas. So many people have started raising some questions, and I've got some ideas that maybe I want to put across. Somebody asked, people don't go to, not everybody goes to church, or not everybody goes to mosque and stuff. I think aside the churches, the mosque, we have the associations, and aside the associations, we have the Afro shops. We have Afro shops where you can dispatch our flyers and stuff. We have WhatsApp groups. We've seen funny videos going viral. This is a noble cause that needs to go viral. So we have WhatsApp groups. We can let this thing go viral. So somebody said we should educate people on the mindset. Yeah, we can do all that on our groups. During our gatherings, we meet once a month. We come together. We discuss issues that are related to our welfare, and this is also another issue that we can also put on our agenda. So every association can do the same. The churches, the pastors can do the same. The mosque, they can do the same. They can put it on the agenda every Sunday, at every meeting it can be on the agenda. And the other thing I was thinking of was also the funding. So, just like you mentioned, some organizations that are ready to come on board. I would like us to, maybe if you are the moderator, we should channel the discussion into maybe 2-3 things we want to achieve before we leave. If we want to look for, maybe we want to have a list of people who can come on board to finance the project, or we know of friends, we know of rich friends, we know of, we have links, people can come on board and finance. We should have a list of people, or people we can go to aside what we have on a list already. And then if we want, if what we lack is, and I don't even think we lack the people we want to reach. I mean, with a church already, so many churches are in Hamburg, and they have the people that we want to reach. So I don't even think the people we want to reach will be our problem. I don't think so. But I will be thinking of how to implement it. So we should have at least 2 or 3 ideas, work around that. If not, we just be jumping from left to right and we won't have achieved anything. Thank you.
Thank you. So then let's come to the main reason. How can we accomplish this mission? How can we do it? How can we do it?
I'm very Reverend Bonnie of the Methodist Church, Hamburg. I would prefer standing because that is my job. I want to address the issue. It's a laudable idea. It's long overdue because we've adopted a lifestyle that does not belong to us as Africans. We have tuned our minds to a set-up goal that does not hold with us well. We need to have professionals. First, we need to identify professionals who will be of benefit to this laudable idea. Before we even tackle people we need to assist. For instance, Ari made mention of counseling, which is very important. We are talking of medical issues. Fine, that is for the body. What about the mindset? We have a lot of people who are in the hospitals. They are not really sick. Even if they are sick, it could be a mental issue. It could be a psychological issue. And when you get professional counselors who are around, because counseling is not advice giving, you have people who have gone through counseling as a course, have their masters and PhD in counseling, and they have been practicing counseling. We have pastoral counseling, which is just related to issues that are biblical, but we need the psychic aspect of the individual to be addressed. So I believe that those mobile services, which is very laudable to all disciplines in our lifestyle, not only on the medical aspects, but all others. We need professional counselors who will be on board to ascertain the status of the person we are visiting. That apart from the medical aspect, the person needs counseling. You go to places, you have people here living in isolation. They are old, they have no companion, they've worked so hard, they die as paupers. Africans, here. Because you know, in Ghana and even in Hamburg here, where are the home for the aged, for the African? So, yes. So, if you are going to give them services, I like that concept of counseling because I'm a professional counselor. And that is why I'm talking about seriously about counseling. So I think we need to identify the experts who will be on board to render these services. Thank you.
Experts on board, professional counselors. That is all.
To look at it from that aspect, I think it will help all of us. We just have to collaborate with the other projects that are available. Once we do that, we'll reach our goal and we'll be effective. Thank you very much.
Do you, before you drop the microphone, do you have any of the structures in mind that you could just bring it out? Do you bring some of the structures so that at least we could know that we could go to the place, we could contact that place? Do you by any means?
There are many.
Many like
I'm coming. There are many. I made mention Mimi. Mimi is also there. Now actually we have something that is coming up regionally. There are so many clinics or hospitals that have been created in various areas. For example, in Duisburg North, there is one coming there. We have also one in Williamsburg that is also coming. It tackles psychosocial stress, depression, etc. And so we are going to have a whole lot of other structures in the environment that we can support. This aspect of supporting cooperations, collaborations, that is the most important thing. It will help also towards the financing. Because if you do things yourself alone, you might not get the political support you need. And in the end, most of the administrations or the administrators will also not hear or listen to what you intend to do. There are the aspect of the racism, and then we have the aspect of opportunism in the way how the so-called white man think. And it is really happening. So once you build a bridge, you do the intercultural orientation, then automatically you will reach to those responsible, those who can give the funding so that the project will become a reality. This is what I'm trying to say. It's just a strategic matter. So let me land here. Then other people can also say something. Thank you.
Okay. I saw somebody's hand over there. Thank you.
Okay, thank you very much. I'm going direct to the finance. I'm somebody, I don't like the German saying better. I don't beg. We have to help ourselves. Africans we have been better and better and better, and that have not helped us. So my decision is, we have so many organizations here, and before this idea, maybe you should have thought of something. One, we see that there's a car over there in Mobile, so we need a car. How are we going to finance it? Because if you are going to ask somebody to give you something, at least you should have provided something. You cannot just go there with lay hand and tell me, please buy me a car. And if that person asks you, how much do you have? He said, okay, I'm not going to think about it. So we have to divide, we have to know how much will the car cost us, this Mobile. Then we divide that money among the organizations. They say every organization is going to pay, let's say, 500 euro within 2-3 months, or 1,000 euro within so and so month. That is my trust and my belief, because I know what I can do, and if collectively we said, okay, we need this money, 20,000, 10,000, 15,000, and this 15,000 is going to be divided among these organizations that we have, I think that will help us more better than going somewhere. We know there are so many ways also to seek help from the state, because I've seen paritatis and so many things, and there are so many ways to make an contract also to get money. But also if they give you, you make an contract for, let's say, 10,000, they are going to gain 20,000 from it. So we have to help ourselves before we go somewhere. So my idea is we should know how much a car will cost us, then we divide this amount among the organizations. Then we see what we can do. That is my decision.
Great.
Thank you very much. I'm Godfred, and I'm actually going to address several points, and I partially agree to what you said, which is we need to find a way to actually combine and find means to actually build this up. But at the same time, what I always say is we all pay tax, and there are certain ways where the state is going to have certain money available, and the person who asks is the one who gets it. But in general, there were many things that were addressed, which I think if it comes to the solution, it's going to be a collaboration of a lot of things. And one thing our sister said was regarding mindset. Mindset, I think the biggest issue that we have with mindset is also kind of education, just basic knowledge. And we need to find a way, or no, we need to find a way, we will find a way to actually be more present. And one issue that I believe we also have in our community is not being consistent. That means if we're presenting something, after some time we stop. But anything in life takes process. That means if we're going to start implementing things, like we want to put in this MMC, mobile medical clinic, for example, and we're starting, we should not expect people to just jump on it because it's new, because everything that's new, people are skeptical. Oh, especially when this, actually I'm not going to go into that topic, vaccine or not vaccine, but anything that comes in, people think there's always something behind it, okay? And for example, if we say we want to get money from the states, obviously we need to show them that it's going to improve something. If we can show, for example, I'm not in the political area, but principle-wise, this measure is going to make this area of the community be more effective, more prosperous, and technically to bring more money into the state's steuer, automatically they will say, okay, it's a kind of investment. And regarding how to do things, as I said, we need to be present. We need to think about how our people, they work. And most Africans, when they get a message through, or they get a video through WhatsApp, it doesn't matter what is said on that video, they believe. So why don't we start creating certain elements to create those kind of videos and spread them around? And we need to really learn, and it's a skill set that we, in the leadership, we need to learn is kind of storytelling. Because when you tell someone, this is good, this is bad, they don't listen. But when you start telling stories, like, and there's one story I always use this, everyone who comes from Ghana or Africa comes here and is expecting after 5 years to make enough money and go back home. Most people start saying, as you said, and all of a sudden they are listening. And when you say, after you came, you realize that life was not that easy, then they'll say, you're right. And then they're listening, and then you can start telling them challenges that we all know and potential solutions that we can use. So it's a skill set which we need to learn, and we need to understand why we are doing this. Because if we don't understand, and we're trying to let people come, they will not join because they will say, you yourself, you don't know. You know that saying, you yourself, you don't know, so why are you telling us to do so? Have you gone to the medical center yourself? And if you say no, they will not even take you serious. So those are elements we all need to educate ourselves. And the last thing I wanted to add is we need to leverage, as you were asking, who do we have available? We know that certain radio stations, all our brothers and sisters, they listen to. We need to be present. We have young people which we are trying to implement, which is a challenge in itself, but we are trying to implement. And we have also young people who are actually active on social media. We can use them for them to talk to their parents, because we're talking about generational barriers, to talk to their parents, so that they will see that there's something there. But it would take maybe 2, 3, 4, 6, maybe 1 year, even 2 years before they'll come. But the moment someone comes and is kind of saved through that project, oh, if I did not go there, I would have been dead. That will spread. And that's why we need to be very consistent in order for it to work out. Thank you very much.
Thank you very much for the time suggestion. Dr. Mendes' hand was up, please. I saw you talk. Yeah, I think you are seeing ghosts. All the same. First of all, thank you very much for your contributions, and I'm really thrilled to be here this afternoon. The topic itself is wonderful, but we need, like the gentleman said, we need to do our homework. Like, you can't go and want to buy a car if you don't know the price. You go around, making trials, probe here and there, you compare the prices, and then you sit down to see, can I buy this? And how am I going to finance it? A mobile clinic, I remember some time ago, long ago, I wanted to go back to Ghana and wanted to buy a mobile clinic. I went to the exhibition, and they have these things when they have the dental exhibitions every 2-3 years. And I asked, I was so shocked to hear the price of such a mobile dental clinic. The thing is, if you are putting the materials or the instruments in a normal room, you have space, to put things and plan. But in a small car like this, trying to fix everything in is very, very difficult. So the work involved is a lot, and it is very, very expensive. In fact, they were telling me something around 300,000 euros. Yes.
That was then, eh?
That was then. Well, possibly now it's cheaper because China is also things you could buy, now you can buy things cheap. Possibly. So we have to do our homework. We don't wish. We are not just going to wish something. We need to know how to implement this wish and whether the wish is practical or possible. Possible, everything is possible. If you want to make it possible, it will be. But then you know what you're looking for. So thinking of the finances is very important. And then, having had our own base, we have so many Ghanaians in Hamburg. Now, many, many years ago, that was the early 70s, I was a student. I went to London and was taken to a party. Honestly, I was so shocked to see so many old people in London. Some of them with braces in their trousers. I said, my God, what are they doing here? Because I came, and a lot of us did, we are going to study, after that we went, 3-4 years. And then we are going back. Okay, we have time to stay. We did. And when it was getting to the end of it, then it became very difficult. So then we tried to work after studying for 2 or 3 years, and then they will tell you to go back home. That's where you start taking a lawyer. All these things are gone, and now we realize 50 years later that we are still sitting here. Now, we need as a group to think. We wish to go back home, but can we practically go back home? It's a question.
Now, why can't we think of alternatives? How do we then live the best of our life is gone, but we still have the best in front of us, the third best. So how are we going to manage it? And the idea with, for instance, old people's brigade is not a bad one. You know, because our children are also being stressed, like we were stressed. They have their children to take care of, and then you'll be calling them to show you this trick on the PC and that trick on the PC. They will tell you 3-4 times when you can't do it. So, Mama, but this I told you that 4 times. So, okay, you too, when I was teaching you, I taught you 20 times before you grasp it. So take your time. And, you know, if this idea of being in a brigade, it's really manifesting, I think it's going to help a lot of us to be able to fight, because the last, you know, our last 8, 10, 15 years, it's a fight we must master. So I think the idea is good, but we need to create like a group, a working group that checks up on the finances. How is this going to cost? How can we finance it? As well as at the same time with Irene, working on this other side too, of taking care of ourselves while all these plans. The other thing is that there are groups where people can also go to when they are sick without having it. It's like practice on the grants. You know, all these things we have to make it known to the people so that while we are preparing for this thing, which is going to take some time to implement, they still will be able to take care of it. Thank you.
So, Oliver Twist, I saw one more. Is there anything that anybody would like to add to raise? Any question? Any suggestions? Yes. Thank you.
Yeah, thank you. Just like I said before, I will be happy if before we leave this place we've achieved at least 1 or 2 targets. First of all, if we're gonna have some working groups, I would like to know if we can ask people if we can decide which topics we want to work on and which people would like to join, so that when we leave from here, all the ideas that we've shared, maybe you go home, you have more ideas. At least you know that this working group, and with this working group, I can channel the ideas, we can share and have a working paper or white paper for the association, or we can know this idea, I can give it to this other group. So if we can form some working groups before we leave, that would be great. Yeah, and then I don't know if the association they've had already an estimate budget for some of the services, just like Dr. Menu said. If we can start with all, maybe we have some set services and we think, okay, this service at least we can start with this service, maybe screening or this and that, and how much would that cost? If we need a van, if we need a car, how much would that cost? If we have at least an estimate budget, so that we know that we are not just working in the vacuum, we are working towards a goal that we want to achieve. And then if we can have a time frame for a particular service we want to, if we don't want to achieve all the services we outlined, at least if you have 2 or 3, we think, okay, in 6 months, in 1 year, we would like to start with this particular one, and then we start working towards it. If not, we won't wait till we get 3 million or 5 million before we roll out, but we can start gradually. Thank you.
Thank you. So, Mr. Secretary would like to say something.
The idea of the whole program that we are together are the experts, and we are the same people going to take decision and implement it. So, but I hope and I wish by the time we finish we get a group, a team that is the working group that which we were suggesting. They will continue with what we have left behind, and then they will continue and bring and get all of us informed about the situation where they have reached the programs. And we have many options. We can, just because we are starting or want to start, we can get in contact with one of the experienced ones, like fire service, like the characters, so that we have partnership with them. If it is possible, they can even line, that is line one of their vehicles to us, so that we'll be able to start, and then we learn from them. Or if we decide straightforward, we want to have our own vehicle and implement it from the start, then we have to, look for other options, which is to the federal government by writing, looking for grants, or to the other organizations. But the idea today is how does the community, the African community, accept the whole concept? If we accept it with the spirit of togetherness, and we can able to forward this strategy. And so the team which we would like to be selected will carry on what we are going to end here. Thank you very much.
Thank you. With that said, that we'll go straight to that. Okay.
Yes, thank you, Mr. Osetito. I think our community have the experience of initiating things that we couldn't finish. So anytime new things come up like this, people's mind goes back to them. And today, I want to echo one of the Ghanaian slogans, the Choboi. Choboi. I said Choboi. It means we need to just put the past behind us. This one, let us rally ourselves and go out there and rally people. One time at the Osdorf Cemetery, I buried 3 people. 3 people on one day. And since that day, the people at the cemetery seems to know me. Because one pastor taking one person, go bury, you come back, and they arrange the next one, you go bury, and they arrange the 3rd one. And all of them were under 50 years. All of them. Yesterday, we buried 3 people. 3 Ghanaians, 2 men and 1 woman. I think all of us sitting here have no problems, let me say that. But the problem is out there. And thank God, you and I are so-called the privileged who know something. And the others don't know. So we need to forget about whatever we have tried, we failed. And this time around, wherever there is a door, let us go and knock. Wherever there is somebody to go to help, let us go and seek the help. At least the time has come for us to be able, we think that the kingdom of God is at hand. This one, it is at hand. So please, this is the last, my suggestion that I want to plead with all of us. Let us push a little bit small. And I believe that with all the know-how of some of us that knows the doors we could go, and then we will be able to rally among our communities. Myself and Alaji and the other senior pastors are here. We will rally the church members, we will spread the news. So those of us that also know the doors, I mean the politicians, the expertise, please, let us not let this one also be another beginning and couldn't finish project. God bless you.
Thank you.
Thank you for the opportunity. I just wanted to add one or two things. I believe that with this project, we can work hand in hand with the telecommunication. Everybody has a phone, everybody knows calls and all that. So let's say we get a hotline. And I believe when you talk to somebody in their native language, you speak direct to the heart. So we get a hotline and maybe somebody calls the number and they are saying, so person will teach you and you're one, person will say gun, we are two, person will say over, we are two. Automatically, I think it will build some trust for people to patronize this mobile medical clinic more than because we are tired of the Hallo Deutsch, blah, 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 like, you know. So that's why we bring them closer home. Because sometimes the language is also barrier with checkups for most of our people. They won't go because to me, even is a problem for most people here. I'm talking as a newcomer, as I will say. So I know the challenges we have as new people in the society. So I think a mobile hotline speaking direct in various languages will help us a lot in making this thing very popular among our community or the target groups.
That's also a very nice one. So then, thank you. After that, then we will try to form the team right now, because so that we have something done, accomplished today.
Thank you.
Those that would like to be part of the team.
Thank you very much. I think this mobile medical clinic, I saw one in Amsterdam, and it was not about human beings. They have these mobile clinic for animals, for pets. They have time and appointment that when they come to an area, you bring your dog, your cat, and then the doctors and the veterinaries, they will take care of your dogs. Even some people brought their snakes. So, yes, some people have snakes as pets. So, please, let's hold this as a good chance for us. Even animals were having these, and people were driving cars, there were doctors on board, and they go from area to area. So if it's now a time that this organization is organizing such a thing, please, let's all achieve and appreciate this. It will help us. Maybe we'll be gone, but our children, our children's children. Thank you very much.
Thank you. So, we need people that will be, sweetheart. Okay, let's the lady talk, then we can go straight with forming the team.
Good evening. Good evening. I thank you all of every aspect for us here to be here. I am from Togo, and I want to say something. What we are doing here is not something to play with it, because it's very, very important that if you see in many years what this project can become, then we will be very, very, very proud of it. Then what I want to say is, I think most of people here, they are from Ghana. But like we are talking about how to get money to buy this car. And this project is not only from Ghana people, it's for all the Africa. It's not to think about how to get a community of each country of Africa. Like me, yesterday, as I received the flyer, I sent it in my group, because I belong to one church in Legenstrasse. But the invitation came late, that's why I couldn't invite people to join us today. But I know that everybody here, they have friends, even it's not only Ghanaian. We have people from Guinea, Alice, then we can invite people to join us, but I think that everybody will like this project and join us. But for what one brother said here is, we cannot go and ask for help without having nothing in our hand. It's very, very important.
And it's disgraceful.
It's disgrace for us too. Even our callers, we are not beloved here. And then to go try, like we are sitting here today now. We can put something to say, okay, for today, everybody can put 10 euro. It's also something. Then to seek forward what we can do is my point.
That's a very nice suggestion.
Thank you.
Thank you very much. So, let's come to forming the team. We will be very glad to know those people that would love to be part of the team. By hand. Those people that would say, I want to be part of the team in taking the decisions and sitting down. So please, let's do it. If we don't get out selected. Because there are some people, or is there any other thing? We need to form a team of people that will come together and sit down and think how many months we will need, what we will need, what. So please, do we have people, volunteers that will say that I want to be part of the team? Yes, please. Oh, please, are you writing the names down? Are you writing the names down so that oh, we have these two beautiful ladies that are sitting down, so don't worry, your names are being written. Please raise up your hands. Let's see those people that will say that I want to be part of the team that will take the decisions, the team that we will give you a set time limit where you will come back, you will call all of us and tell us this is what we have come into conclusion with, this is what we thought, this is what whatever from A to Z. So let's see. Thank you. Please. Do you have all? Okay. Okay, let's do it. Daddy, could you please stand up? Write the names. Write the names and please stand up.
I'm taking photos of the names.
Okay, super. Oh, you see technology. Feeling that? Technology, you know? So, let me see how many people, because we need a lot of hands. Let's see again. We need a lot of people. This collective idea is a lot of people. And please, what we are saying right now is that if you know time will not permit you, please don't raise your hands. Let me emphasize on it again. If you know time will not permit you, where they will call you for meeting, and you say maybe because of that, please, because this is a very good thing that we really need to. So, how many people do we have?
You have scared them all.
Oh, don't worry. I just want them to be mom. I don't want anybody that will say this, but I know all those people that have raised their hand, they are very committed. For that one year, I'm very, very sure. You know? Great. Okay. So, with this said, let me ask the person, when do you think you can meet all of us to give us your plan, what you have planned? Do we need to give you 3 months, 4 months, 2 months? What do you think? We need a date set before we leave here. Sorry, better?
You cannot say the date right now because everybody has his plan.
Yeah.
Then, like you collect the names from here, like you collect the names, you take our number so that we can build a WhatsApp group so that we make appointments.
Now, that is why we want, because we need to set a date. For instance, when we say, we've taken all your names, you can tell us, maybe you will meet us after 6 months. Or maybe in a month. Or maybe in 2 months. That is up to you, but at least we need to have a fixed date before we leave here. You know, so that we will not just leave it like that. Fixed dates. So if 2 months will be fine, but you know that you are working under time. So, do we do 2 months?
2 months will decay.
Can you hear me, please?
In a month's time.
Please, Excuse me.
Sorry?
Yes, Nana Basua.
Nana.
Please, your question must be wait because we have a leader here. Now you have collected our names. So the leader will get all the names and call us together and we'll make an air meeting so that he can give you the correct dates.
Nana, I really understand you, but to get something that we don't have to leave it like that.
Yeah.
So you can give us maybe like 3 months or maybe 2 months.
Leader, then you have to come and take the microphone and
maybe like
say,
so that
maybe
we live here so they know that they are working under time.
Yes.
So please, to get something done, we must have a time frame.
So please give us time, maybe 2-3 minutes.
There. So you will form it. That is why within this 3 months or within this 2 months, you will have to communicate yourself.
Mrs. Ari, we are waiting for your discussion, please.
Please. So, genau, that is why, say, the secretariat, you will form it. But within this 2 months time phrase that you will have, you will form it within that time. Because that's why I'm saying you give me maybe 2 suggestions. You can give me maybe 2 days so that we know that, okay, maybe 2 months or maybe a month.
Hello.
Okay.
Yeah, since you're trying to hesitate, I'll say my own. I even put on a paper that at least we will need to meet again in 1 month. Before even we came to my own thought, I was thinking at least in 1 month time we need to meet again. It's not mandatory that we have to get everything set in 1 month, but we need to meet. And then the report on what we have got so far. It doesn't mean we have to get everything done, but at least we need to meet on monthly basis. I even think we will need to meet monthly basis. This is my suggestion.
Okay. That's also a nice suggestion. So we'll be going for a break. A short break. And when we finish, whilst we are having our break, please, we will not leave until we have a date set. So please think about it so that at least when we come back from the break, something must be written down. Thank you very much for your understanding. God bless you. Please have a short break.
My God is able, He never leave me nor forsake me. He's always there for me. 24/7 I can call Him. Whenever I'm down or if I'm happy, I can always count on Him. Only you deserve the glory. Only you, only you, only you can do. The Lamb, my Savior, my Redeemer, your love never ends. Whenever I'm down or if I'm happy, I can always count on Him. Only you deserve the glory. Only you, only you, only you can do. Only you, only you. Can do. Hey, nana 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 the lion and the lamb, my savior, my redeemer. Your love never ends. Whenever I'm down or if I'm happy, I can always count on him. Only you deserve the glory. Only you, only you, only you can do. Only you, only you, only you can do. Only you, only you.
Great way, Dr. Menu, to please come. Let us show her some love. Doc, thank you very much for serving us. Thank you very much for standing out for us. Thank you.
Good evening, ladies and gentlemen. I thank the organizers for involving me in this very, very great project. It's sort of late, so I'm not going to bore you too much with too much talk, because there have already been many, many talks, and I can look into your faces after eating something, you know, so you sort of get a bit tired, and the brain does not absorb so much, so we make it short. I'm very happy to have an organization thinking about the health of our people. And all of us must do what we can to promote this great idea and to contribute whatever we can to make it a success. I'm also very, very happy to realize that our youth are also very, very seriously engaging themselves in our community. You know, to have your child, like the lady could easily be my daughter, standing here, giving us lectures, you know, really caring for us. That's all we want, mothers and fathers, that our offsprings will not just go into the German community, feel very comfortable, and don't bother about us, but that our health and our welfare is also on their hearts. Thank you very much. We have already, like I said, it's already late, so I'm not going to bore you, but I wanted to tackle just 2 points. One of them is the intake of water, ordinary water. Normally, we drink when we're thirsty, like get up in the morning, drink a bit of something. If you are very busy, you might realize that for some 2-3 hours, you won't even drink anything. Until break time, and we don't have the culture of always drinking water. And I just wanted to give a small, you know, insight into what water does for us and why we have to be seriously considering making sure that our bodies have enough water. Why is water so important? Water is needed to flush out waste from our body. The kidney and the liver, they do a lot of work, but the residue or the results of our metabolism needs to come out, and mostly it comes out through water. Apart from flushing out waste from our body, water regulates also our body temperature. Water helps our brain to function. It helps create saliva. Like if there's not, there are people who have very dry mouths, and it makes it very difficult for you to even swallow the food you've eaten. It is the main component of saliva, and this saliva also contains small amounts of electrolytes, mucus, enzymes, and all that the body needs. Staying hydrated is crucial to maintaining your body temperature as well. Our body loses water through sweat during physical activity and in hot environments. In fact, even when we sleep, we sweat a lot. That's why in the morning you see people hanging their bedding outside because it's moist. Our sweat keeps our body cool, but our body temperature will rise if we do not replenish the water we lose. That's because our body loses electrolytes and plasma when it is dehydrated. If you are sweating more than usual, make sure you drink plenty of water to avoid dehydration. Just making the point because it's already late. It helps excrete waste through perspiration, urination, and defecation. Your body uses water to sweat and have bowel movements. You also need enough water in your system to have healthy stool and avoid constipation. Your kidneys are also important for filtering out waste through urination, and adequate water intake helps your kidneys work more efficiently and helps you to prevent kidney stones. Drinking plenty of water during physical activity, like we know a lot of people who go to physical training, they always have a bit of liter of water in their bags. Because you lose a lot of water, you need to replenish it. Hydration also affects your strength, your power, and your endurance. You may be more susceptible to the effects of dehydration if you are participating in very serious activities, sport activities. Like I said again, water helps prevent constipation. If we eat a lot of fiber, the only way to prevent constipation is to get in a lot more water so that you can get it out. It's also important to maintain your water intake so your bowel movements contain enough water. If you do not consume enough water, magnesium and fiber, you may be more likely to experience, constipation, like I said. It aids in digestion. That is why when we are eating, we also have to drink a lot of water. During and after a meal, drinking water will help your body break down the food you eat more easily. And this will help you digest food more effectively and get the most out of your meals. Research shows the body adapts to changes in the consistency of food and stomach contents, whether more solid or more liquid. It helps with nutrient absorption. In addition to helping with food breakdown, water also helps dissolve vitamins, minerals, and other nutrients your body, the food contains. It then delivers these vitamin components to the rest of your body for use. Interestingly, water also helps you to lose weight. Studies have linked body fat and weight loss with drinking water in both overweight girls and women. Drinking more water while dieting and exercising may just help you lose extra pounds. It's interesting, in Africa we like people with a bit of flesh. Here in Europe, we want people who are slim. Which is better? We don't know. It improves blood oxygen circulation. Water carries helpful nutrients and oxygen to your entire body. Reaching your daily water intake will improve your circulation and have a positive impact on your overall health. Drinking enough water can help prevent certain medical conditions. For instance, urinary tract infection, hypertension, etc. Water helps boost energy. Drinking water may activate your metabolism. A boost in metabolism has been associated with a positive impact on energy level. One study found that drinking 500 milliliters of water boosted the metabolic rate by 30% in both men and women. These effects appear to last over an hour. It aids in cognitive function. Proper hydration is key to staying in tip-top cognition shape. Research indicates that not drinking enough water can negatively impact your focus, alertness, and short-term memory. It also helps improve your mood. When somebody is angry, normally you just, if you want to be good to that person, just give him or her a glass of water. After drinking it, you realize that tempers go down. It helps also keep your skin bright. Adequate water intake will help keep your skin hydrated and soft and may promote collagen production. However, water intake alone isn't enough to reduce the effects of aging. Otherwise, we old people would drink the whole water. This process is also connected to your genes and overall sun protection. I'll come to sun later on. Dehydration is the result of your body not having enough water. A lot of old people die of dehydration. When you are sick and in hospital, you are hospitalized and nobody comes to give you water frequently, you might even forget to drink water. At times, you have old people, the food is there, they will eat a bit of it, they forget to drink water. But the body needs water. So they get dehydrated, and of course the other functions of the body also can then function properly, and they die of weakness. Severe dehydration can result in a number of severe complications, like swelling in your brain, kidney failure, and seizures. Make sure you drink enough water to make up for what's lost through sweat, urination, and bowel movements, and all to avoid dehydration. How much should we drink? Being attentive to the amount of water you drink each day is important for optimal health. Most people drink when they are thirsty, which helps regulate daily water intake. According to the National Academies of Sciences, Engineering, and Medicine, general water intake from all beverages and foods that meet most people's needs are about 15.5 cups of water each day. Can you imagine that? 15 cups of water. How many people can actually say that they drink 10 cups of water a day? 2, 3. In the morning, at breakfast, probably lunch, tea, and then till evening, so that, in fact, we don't even meet a quarter of the requirements we need. That is why it's very important to consciously drink water. Always have a liter of water standing. You're passing by, drink a bit of it. Even when you don't feel thirsty, you don't need to feel thirsty to drink. You must drink all the time. 15.5 cups of water. So if you, like for instance, if you drink 5 in the morning, 5 in the afternoon, 5 in the evening, okay, when you get a bit older in the evening, you have to drink less water because then it might disturb your sleep. People get about 20% of their daily water intake from food. The rest is depending on drinking water and water-based beverages. So ideally, men would consume about 100 ounces or 3 liters of water from beverages, and women about 73 ounces, 2.2 liters from beverages. You have to increase your water intake if you are exercising or living in a hotter region to avoid dehydration. Other ways to assess hydration include your thirst and the color of your urine. You can see from the color of your urine if you are drinking enough water or not. At times the urine is lighter, and it can get darker or yellowish. You realize you are missing something. So you drink water before you start being afraid that you've got jaundice or whatever it is. Just drink water, a lot of water, and you feel a bit elated. Other ways to assess hydration include your thirst and the okay, I've done that. Feeling thirsty indicates your body is not receiving adequate hydration. Urine that is dark or colored indicates dehydration. Pale or non-colored urine typically indicates proper hydration. Water is important to nearly every part of your body. Not only will hitting your daily recommended intake help you maintain your current state of being, it may even improve your overall health. Here are some ideas for how you can be sure you drink enough. Carry a water bottle with you wherever you go. This way, you can drink whenever the need strikes. And then when you are busy and you realize that the middle in the afternoon or so, your glass is still full, then you know you are missing something, so you fill it up. Keep track of your intake. Aim to take in optimum amounts every day, a minimum of half your body weight in ounces. Okay, I think 15 cups, that is a good measure. So pace yourself to approach half of your recommended consumption by midday. If by midday you haven't even drank 5 cups, you know you have some deficit from the day already. So then you have to continue drinking more. You can always finish about an hour before. So before you go to sleep, you don't need to drink too much water because it will disturb your sleep. So ladies and gentlemen, taking in water is very important, and we have to really make consistent effort to make sure that we have enough water in our bodies. Now, the very one thing I just want to mention, because if I would talk about it like I wanted to, it's already late, it would take too much time, and that is about vitamin D. Vitamin D. You know, God made us the way we are for a purpose. We are supposed to live in Africa, that's where we come from, and Africa is hot. So he gave us the skin to filter the sun's rays that is hitting us. You know, there are times when you are standing in the sun, you really feel the heat. Your whole body, even if you take the temperature, you realize it's hot. Now, our skin sieves it, it filters, and let in that what we need for the formation of our bones, for our functioning properly. Now, what happens when we leave these zones trivially and come to live in these areas, temperate zones? One, we don't get enough sunshine. Because even the bit of sun that is coming through the rays here, it doesn't get into our bodies because it's so cold. We cover ourselves also with so much cloth that even the bit of rays coming doesn't get to us. Plus the fact that we are too busy to even get outside to get a bit of sunshine. We work inside rooms, most of us, you know, all professions. You go in the morning, go inside the room, you have a break, eat something, go home, inside the room. So we don't get enough vitamin D. And it's in all groups. If you go outside with a white person in the sun, in 20 minutes, that person would have gotten the amount of sun. That's why they have all these creams, so that they don't burn. Yeah? Well, we don't even go into the sun. And even if we do, the rays doesn't get to us because our body filters the bit we are getting. So you see how important it is for us to not only go out and get sunshine, the bit we can get, but to supplement our food with vitamin D. Very important. So ladies and gentlemen, please, when you go out, go to your doctors, insist on their taking your blood and letting you know how much you have. A lot of you, a lot of us. I was shocked myself when I realized my vitamin level. It was catastrophic because I'm inside the practice all the time. And at weekends you are busy cooking, shopping, watching. Have you seen Africans lying in the sun? I haven't seen many of them. Have you? No. Number one, we don't have time because we have 3 jobs. Yeah, the other one is paying the rent, the other one is paying this, the other one is building a house, and the other one is going to the family. There are 4 of them. Vitamin D gives you... Now, how about it?
Doctor, does the high soul not substitute the sunshine?
Pardon me?
The heater, the high soul.
No. The heater gives you heat, but doesn't give you, it's not sunshine that will give you vitamin D. So please, it's so much on my heart, please. I know of a person who got, really, who no longer could walk properly because he had been sitting on the computer most of the time and didn't realize that, his bones, the bones were getting weaker and weaker. So if you force the bone to be in a particular position for many, many years, you realize, you are getting a sheath, German would say. So please get your vitamin levels checked. And if it's deficient, the vitamin D3 tablets here, they are not expensive. They are not expensive. You can get it from the apotheke. You can get it, it's nutrients. Pardon me?
What do we eat to get vitamin D?
Well, thinking of the vitamin D comes from the sun, which we are not getting. So eating plantains or cassava or yam might give you something else, but certainly not vitamin D. So you can get a supplement. That's the good thing about it. What you don't have, the other vitamins we lack, you can also get supplements for it. But this D is also very important. And they had a research done on Black Americans who were getting COVID, because a vitamin D also helps you with your immune system. It gets you, it gets you a high immunity if you have it. And those who were getting COVID and dying, it was realized that most of them had very, very low vitamin D levels. So please, if we can take something this evening for, as an advice, let us get it checked, let us supplement it if need be, because it's possible to supplement it. Thank you very much.
Thank you very much, Doc, for that advice. Vitamin D, we need it. So we need to wrap up the program, so we will call then Mr. Osei to please come and give us a wrap up of what we've done so far.
Thank you very much. You have just impressed us. The attendance, the participation is very impressive, and it has given us the energy to move forward with the program. Thank you very much. So far, we had over 55 people here, which is the maximum capacity. And but with time, they gave us up to 9 o'clock because tomorrow, early in the morning, that is election is taking place in this very hall. So we just have to prepare the room for tomorrow's election. And to wrap up, so far what we have discussed, I think that is it's like unanimous. That is everybody here support the project. That we should continue with it. And there are 11 people who have stood up to be part of a team, and this steering team will continue from what we have left here. And the team will continue to have communication links as soon as possible, so that by December we'll be able to give the first report to our community members, so that we know our problems and where we can also make positive impact. Sorry. So, so far we will be leaving you here, and I think all of you here have seen how impressive today's event is. And we thank you very much for your efforts, for your participation, for the energy, ideas, and we will continue to have contact with you. And I hope in the future we'll be able to meet again, and maybe in a bigger way, so that the community, all the community members, all the nationalities in Africa community will be able to take part here. So once again, I thank you, and those in the team, we will soon contact you, and then you know when we will start everything. Thank you very much. Thank you very much.
The President thanks and loves you all.
So, we have come to the very end of this amazing coming together. I believe we all agree that we have been productive, at least in the setting up of the team. And I hope that each and everyone that volunteered to be a part of this program will also do their best to commit to it. I want to, on behalf of the organizers, that is the Ghana ex-men, ex-servicemen, and the Mali diaspora, I want to thank you all for your participation, especially to those who work behind the scene, because putting a program like this, you know, it demands a lot of work, a lot of time, a lot of planning, and so thank you all. I also extend, we extend our profound gratitude to Dr. Dosu for her time. Actually, it's a birthday, and for her to actually commit to be here on her birthday, thank you so much. Thank you. Happy birthday, happy birthday, happy birthday to you. Also, our thanks to Dr. Victoria Menu and Miss Irene Apia, also for their extraordinary leadership and guidance in the planning and executing of this program. Thank you also to every individual that came. Actually, we cherish your time, 4 hours in this place. Don't think that it was not noticed, but I believe that it is a sacrifice that was made for the community. And so thank you so much. And so with this, and also not to forget the sponsors, that is the Burger Stiftung Hamburg. So thank you all for coming. Thank you also to Lynn and Katia. Thank you so much for your good job. And so thank you from the team, from myself, from the leadership.
So then we invite Imam Arimiya to please come and close the program. Please, let's welcome him. Thank you.
I salute you by saying Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum is, the meaning is peace and blessing of God. Allah be upon all of you here. I'm so grateful. I start by saying Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amen. I just recited some verses from the Holy Quran. I was so grateful. The cooperation, the coordination, the love. I'm so happy, especially for this particular project. It was an impromptu invitation for me today, and that is why you saw me in this outfit. So pardon me.
You look nice.
Oh, thank you, Grandpa. All of us did very well here today. I cannot mention names. I can see my youth members here. Reverend, I'm so happy with your big suggestion that you brought up. Doctor, there are names that I just noted in my head, which time won't permit me to mention all. But never mind, or don't forget, our time that we spent here today has been rewarded by God. We didn't waste our time here. We came here purposely because of what? Help. We got a lot of inspirational messages from Irene, although I came late, but hopefully I'll get your script. Doctor was here to educate us on the basis and the importance of water. We are so grateful for that. And we hope and pray that all that we acquired here today, we are not leaving it here. We are taking it home to put it in practice. May God bless each and everyone here. May God continue to give us help, the energy to worship Him. We shouldn't forget once again, the food that we eat. We are not eating it for anything, but rather to worship the Almighty God. Your God, my God, the God for the Christians, the God for the Muslims, the God for the Jews is one God. So that is what brought us here today. So I pray God should take us back home safely. I pray in Allah's name. Amen. Oh, yeah. I just remembered something. Tomorrow. Very good. She just reminded me. Please try as much as possible to go and cast your vote tomorrow. Yeah. Please. Those who have already done theirs by posting, it's gone. Okay? Please, those who go and do it presently, try as much as possible to go. And don't forget, I learned there is one particular person who we are using his key holder here, and even one of the drinks here. Yeah? Please try to vote for him. For the red, yeah? Okay. Thank you.
Thank you. So please, somebody have misplaced his or her handy. So please, in case if you have seen it. Oh, thank you very much. We've seen it. Great. And then doctor have informed us that the vitamin D is 21 euros. 21 euros. To get your vitamins checked, it is 21 euros. That is it. And don't forget, be the change that you want to see. Be the change that you want to see. Thank you. God bless you. Thank you.
I'm not